Ladies and gentlemen, hello, welcome to another episode of the Question Bank. Today we've got a pretty big question, so let's take a crack at it. We have a 57-year-old man who comes to the emergency department with progressively worsening back pain that is severe in nature since the past 2 weeks. The pain is at the mid-thoracic level, and he describes it as a band wrapping around my upper abdomen. The pain is associated with tingling, weakness, and numbness in the lower limbs. Review for all other symptoms, including bowel and bladder incontinence, is negative. Past medical history is significant for chemotherapy and radiation therapy for non-Hodgkin's lymphoma completed 7 months ago. On examination, hyperreflexia is noted at the patella and Achilles tendon, with motor strength deficits noted of equal quality on bilateral lower extremities. Upgoing Babinski reflex is noted. Which of the following is the best next step in management? So, whenever we have the next best step in management, let's first find out what's wrong with the patient. So, we have our first step, which is demographics. We have a 57-year-old man. Emergency department, so it's an acute event in a 57-year-old gentleman. Progressively worsening back pain. Severe in nature, past 2 weeks, so it's getting worse and worse and worse. So where is the back pain? Mid-thoracic level, and we have a very good description. A band wrapping around my upper abdomen. Okay? Whenever there is a classic description, we have to think what is associated with these classic descriptions. Okay? So let's see. The pain is associated with tingling, weakness, and numbness in the lower limbs. So we have sensory issues and we have motor issues. So both motor and sensory neurons are affected in this case. Okay? The patient does not have bowel or bladder incontinence, so we can kind of rule out Cauda-Equina syndrome over here. Okay? Now, here comes the absolute key part of the question. The past medical history is significant for chemotherapy and radiation therapy for non-Hodgkin's lymphoma completed 7 months ago. Okay? Why is this important? We will come to this very soon. Another thing on examination, hyperreflexia at the patella and Achilles tendon and motor strength deficits of equal quality on bilateral lower extremities, and an upgoing Babinski reflex is noted. So, a couple of things I want to point out for you over here. Non-Hodgkin's lymphoma. When we think of non-Hodgkin's lymphoma, or any cancer for that matter, we have to think, is the patient in remission or is the patient having metastatic episodes at the moment? Okay? And is non-Hodgkin's lymphoma one of the cancers that can metastasize to the spinal column? And the answer is yes. Alongside non-Hodgkin's lymphoma, you can also consider prostate, lung, and even breast cancer and renal cell cancer as the cancers that metastasize to the spinal column. Okay? This is very important to note. So this could be metastasis. We don't know yet. We can't say for sure yet. But the patient's having neurological symptoms, a combination of lower motor neuron with the weakness, okay, and upper motor neuron with the hyperreflexia symptoms. We have both upper motor and lower motor neuron symptoms. Add this to the fact that the patient is describing the pain as a band wrapping around the upper abdomen. We have to think of potentially an epidural spinal cord compression. This is a cord compression that is happening in this case. What do we do for cord compressions? We know antibiotics are not going to help with epidural spinal cord compressions. If there is an epidural abscess, you will see back pain and a fever. Okay? So we can exclude B and E. Okay? A lumbar puncture in this case might actually make things worse. You have to rule out the patient does not have risk factors for herniation. There's no lumbar puncture, won't tell you anything in this case anyways. We can rule out C. Now, do we just do an MRI or do we give corticosteroids? Guys, always remember, with spinal cord compression, you always give them high dose steroids plus an MRI. This is a rule. Do not forget this. You could save someone's life. The correct answer in this case will be high dose corticosteroids and MRI of the spine. Always remember this and nail those questions on your exam. Thank you so much, guys, for listening, and stay tuned for more.